My name is Ranjit. I am from Kerala. I am 4 days chiropractic. Sorry, bone setting and scrubber courses I have attended.
ഞാൻ വിജയ്, കോഴിക്കോട് ജില്ലയിലെ വടകരയാണ് സ്വദേശം. കളരി മർമ്മ, ചൂടാണി മർമ്മ പഠിപ്പിക്കുകയും കളരി മർമ്മ ചികിത്സയായിട്ട് ഇപ്പോഴും പഠനം നടത്തിക്കൊണ്ടിരിക്കുകയാണ്. 28 വർഷത്തെ കളരി പരിചയമുണ്ട്. ഇവിടെ ബോൺ സെറ്റിങ്ങും അതേപോലെ തന്നെ ഇന്നെടുത്ത മർമ്മ ചികിത്സയും വരാൻ പോകുന്ന ക്ലാസ്സുകളും അങ്ങനെ 4 ദിവസത്തെ ക്ലാസ് അറ്റൻഡ് ചെയ്യാൻ വേണ്ടിയിട്ട് വന്നത്.
ಇವತ್ತು ಗೋಲ್ ಸೆಟ್ಟಿಂಗ್ ಕ್ಲಾಸ್ ಮತ್ತು ಮರ್ಮ ಕ್ಲಾಸ್ ಅಟೆಂಡ್ ಆಗಿದ್ದೀನಿ. ಥ್ಯಾಂಕ್ಸ್.
I'm Shobha. I came from Bangalore and I have joined 4 days class. Ayush Darpan class. Thank you.
मैं हैदराबाद से हूँ. मैं काया चिकित्सक हूँ.
Dr. Shinas, coming from Upलब, Kerala. Currently, I'm working as an assistant professor, Department of Part-3 in Sri Babasam JC College, program at UP. And I'm coming here for attending that Ayush Darpan 2 days workshop.
Hello, I am Yogi Adikara, working in City Holistic Life.
Holistic. I'm from
I'm Durai, Chennai and Varaya. Sports physical practice பண்ணிட்டு இருக்காங்க. 4 days bone setting class வந்து அதுக்கு எந்த வகையில் யூஸ்ஃபுல்லாக இருக்கும் அப்படின்னு பார்க்கறதுக்காக ப்ராக்டிஸ் and treatment.
ഞാൻ ആസാദ്
I'm Satish, ഗുരുവായൂരിൽ നിന്നും.
I am
कोई बात नहीं, अभी इंट्रोडक्शन होने दो, फिर बाद में हम लोग कर देंगे. हम बैठ चलते हैं.
और പഠിക്കാൻ വേണ്ടിയിട്ട് 4 ദിവസത്തെ കോഴ്സ്
आवाज आपका आवाज आने को पूरा नाम बताओ, कहाँ से आए हैं?
मैं आंध्रा से आया हूँ. पेशेंट कलारी मर्मा.
ठीक है.
बॉन सेटिंग अभी इसके लिए पूरा.
ठीक है.
My name is Santosh. I'm from Bangalore. I do practice Ayurveda.
My name is Dr. Sushant, Siddha Doctor. I am from Thrissur. 4 ദിവസത്തെ കോഴ്സ് അറ്റൻഡ് ചെയ്യാൻ വേണ്ടി വന്നതാണ്. Thank you.
Hello, I am Dr. Reshma Mohan. I come from Cochin. I practice Ayurveda. I came to attend the 2-day program of Ayush Darpan. Thank you.
എൻ്റെ പേര് ദിനേഷ്, പാലക്കാട് മണ്ണാർക്കാട് വരുന്നു. തെറാപ്പിസ്റ്റായിട്ട് ജോലി ചെയ്യുന്നു. 4 ദിവസത്തെ ക്ലാസ് അറ്റൻഡ് ചെയ്യാൻ വേണ്ടി വന്നതാണ്. എൻ്റെ പേര് രതീഷ്, ഞാൻ അവിടെ നിന്ന് വരുന്നു. തെറാപ്പിസ്റ്റാണ്. 4 ദിവസത്തെ ക്ലാസ് അറ്റൻഡ് ചെയ്യാൻ വേണ്ടി എത്തിയതാണ്.
किसी को चाहिए आपको बुलाना पड़ेगा.
Raju
Blood letting का
from Bhulekar.
blood letting का इसका मिला कैसे था
Dr.
वही तो
Vinod
सिखाना है ना
And Dr. S.J. Pahi from Karnataka.
हाँ not necessary ये कल पढ़ता था मैं
I am Dr. Shandaru from Karnataka.
ऑर्डर मंगाना जो मंगा लेंगे हाँ ऑर्डर मंगाना
Myself, I am Dr. Anand, the doctor from Kanpur.
मैं विजय कॉटन विजय कॉटन कॉटन
I am Dr. Aisha from Palakkad. What is function?
Dr. Sharma from Palakkad for politics. Dr. Nitin Thakur from Kutch, Gujarat, doing CRAV Rusty Varma Chikitsa in Palakkad. I have come here for 2 days workshop.
Myself, Dr. Narutna Master from Karnataka.
Myself, Dr. Vinod Jadhav, working as a professor in the Department of Pharmacy. I came from Karnataka. This is first day of my session.
Myself, Dr. Shailaja, working as associate professor in the Department of Tropeguna at NK Junction TRV College, Bidar, Karnataka.
Myself, Dr. Kalyani, working as medical officer in government at the dispensary, Karnataka.
Dr. Satish from Ballari.
Dr. Nandini Pandit from Raichurpudi Maharati Medical College, working as an assistant professor in Arts from Karnataka.
Myself, Dr. S.L. Nandit, working as a Ayushman Darpan Primary Health Center.
डॉक्टर शोभा के पास डॉक्टर शोभा के पास और डॉक्टर शोभा माइक ले लो आइए आप बैठो व्हाट कंप्लेंट्स यू आर हैविंग उधर देखिए
So I'm basically so I have been early morning every day at this. So I'm unable to do my some knots in my hands, 6 fingerprints in it's
So do you want recovery? Yeah, definitely.
अभी इसको शूटिंग कैसा करना है देखो
We will do the live demonstration of the blood. So you just सीखना है नहीं आएगा
This is not plantar fasciitis. This is plain case of tendo-Achilles. Tendo-Achilles. Okay. She is not having plantar fascia. If she is a patient of plantar fascia, then she complains pain over here, or on the ball of the plantar fascia, or on the lateral side of the plantar fascia. I am audible to you? Yes. But if she is complaining pain over here, this is Achilles tendinitis. Clear cut a case of Achilles tendinitis. This is not plantar fascia. Okay, you got it? Yeah. Now I am going to perform Raktamoksha on her with her permission. So I advise to take her 2 cups of paisam. That is a snepan, very necessary.
So prior consent is required. Yeah.
Snepan is very necessary. So I advise her to take paisam.
camera video.
You make by. Yeah.
This is a 11 number blade. 11 number sharp blade. This is the 11 number sharp blade. Okay. I'm now going to perform a simple cuts over here. Now ये ब्लीड होना दिखाओ दिखाओ ये ब्लीड हो रहा है दिखाओ बस क्लोज दिखाओ ओके ठीक है just applying the syringe over here. This is the technique without using jaloka. We have to make this self retaining. So okay,
Look how the negative pressure is created and how the blood is just.
Syringe has been applied. Patient is okay. She is taking her breath. She can talk with us. So, what is her feeling? Aapko, what is your feeling when I was performing this type of surgery on your leg?
As a surgical process.
The surgical process.
Just little bit pinching sensation I have. Just a little bit pinching sensation I have. Now that I feel little bit of pressure, like sucking, but it is not that much pain.
All of you see that the collection of blood is here now. Okay, this is a collection of blood. Collection of blood is here. Very close now. Waiting.
Slightly. Yeah.
Right. Yes.
Yes. This is the technique you can apply everywhere. It may be here, it may be here.
This is near the Gulf Marma. Just look. I will explain you what is the Marma point. Gulf Marma. Nearby to the Gulf Marma point.
But not sir on Burma points.
No, nearby.
Never use this technique on Marma points.
Nearby to the Marma.
Only nearby.
Yes.
It is nearby to the Gulf Marma. I will explain.
Now during the procedure, we are asking her about the pain. Do you feel any pain here?
No.
Do you feel any pain here?
No.
Do you feel any pain? Do you feel pain here?
No, sir.
Here?
It's completely very less.
It is comparatively very less. But this is the success of this treatment. This is the success of this treatment. So, what is our science stated that Dushta Raktapadana Satyo Rajam Shama. So, this is proved that whatever our Grantha or our ancient scientists says is perfectly clear their vision about Rakta Moksha. So, I am very thankful to Dr. Shobha to permit the Rakta Moksha on herself. And now a second procedure that she is having some granthis on her left hand. This is her right hand.
The sugar patient can do.
Yeah, you don't bother about sugar. You don't bother. The patient's body itself can take her own time to cure everything. But we are bothering about you are having diabetes, you are having hypertension, and everything. Why you are bothering about?
Sugar patient.
Now, we actually thank Dr. Shobha that she bravely inspired all of us about this patient.
Is that blood is pure or impure?
This is impure. I am definitely going to show you how is it. This occult blood will be there. Then, sir will definitely explain you what is the pramana of this Kurchashira Marma. Kurchashira Marma, that is 1 anguli only. Pramana of the Marma is 1 anguli. The pramana of this device is 1 anguli. Got it?
1 finger.
1 finger. This is also 1 finger. Pramana of this Kurchashira also 1 finger.
कितना ब्रेक हम एक्सपेक्ट कर सकते हैं?
15 minutes. You have to keep this series over here. 15 minutes. 15. 1 5.
It is a very simple procedure. You have to take proper sterilization, and you can do it without any
Without anesthesia.
Without any anesthesia.
That depends. That depends. Very nice and practical question you have asked. In 90% of patients, they don't need another Raktamokshan session. But if the patient don't result, then I would like to suggest them this procedure can repeat 2 times again. After giving Snepan, complete Snepan. Complete Snepan. Do you know Snepan?
Yes, sir.
तो वर्धमान मात्रा में स्नेहपान देके आप ये प्रोसीजर कर सकते हो with giving our Anapachaka Dravya and Raktapachaka also. Okay? Got the point? Yes?
Gaps are in between the sessions.
Yeah?
Gaps are in between the sessions.
15 days.
15 days.
Yeah. Yes, already our Grantha told us that we can repeat the procedure after 15 days. This is Vagbhat Sutrasthana, 28 number, 27 number chapter, and something slow, I think it may be there about 40 or 44, something like that. But we have already mentioned it. See, doctor is totally away from the patient. Work is going there.
Blood is already just coming out, sucking, negative pressure. This is allow same action is there. They are also sucking the blood by creating the negative pressure. What is the difference between? Only difference is that the Zeloka itself induce some chemical that is eroding, say through saliva. And in such cases, only the Dushita Rakta is coming out. So basic difference is that. And the string, I think that Dr. Rajguru will explain more. The stringa which we apply or other the Dizama, this is also based on the same concept.
Same concept.
Same concept. So, but I think that nowadays you are just putting certain cups for cupping. You can do it in OPD also. You can do it for patients also. So it's everybody can do it. But only one thing, Dr. Rajguru, I think that all must keep there in mind that sterilization is needed properly.
Definitely sterilization is needed, but as per my experience is concerned, I was working in rural area and tribal area. So I don't feel any problem while performing this type of operations on patients. They don't get any type of infections or any type of problems.
Yeah, it may be due to the tribal areas, the immunity level is very high, but
if your mind is strong, no one can hurt you. But if your mind is low, you definitely get have
What is
idea.
the do's and don'ts and which we have not to do and which
रक्तमोक्षण के लिए जो योग्य है, ये who are capable for doing for undergoing the रक्तमोक्षण is already described in our text.
Sir, if we take the discipline for
very good. Very good question.
it's right to do.
अगर कोई कोल स्प्रिंग खा रहा है तो क्या उसका रक्तमोक्षण करेंगे?
सही बात है. It is very practical question, but I have not experienced this type of patient. I have not experienced this type of patients, so I can't say. If you want to perform the Raktamokshan Kriya on patient, then you have to stop the discipline first.
Yeah.
Then you wait for 10 or 15 days, and then you have to undergo this.
And is there any
This is very practical.
Leech is right.
Leech you can apply leech, you can apply this radiotherapy.
And I think that sometimes people also do some routine investigation like BTCT. If sometimes we miss the patient bleeding time, if she in 1,000 one patient came. In such cases, when we just remove the blood, it once it yeah. So if you know the history of patient,
if you know the total history of the patient,
then it's okay.
Second, if you are having that much confidence, the doctor should be a very confident one. Second thing, he must have eagles. Okay? जैसे कि वैद्य कसा असावा, पेशंट कसा असावा, परिचारक कसा असावा आणि रुग्ण कसा असावा. आणि जैसे रुग्ण
देख रहा था आधे घंटे से वो उनसे चैट कर रहे थे, तो वो क्या कर रहे थे, अब समझ में आया कि वो पूरा कॉन्फिडेंस
camera yes. That's the occult blood. What Grantha told us, this is totally अवगाढ़तम रक्त बोलते हैं इसको. हाँ, what was the question? Bleeding का क्या बोल रहे थे कोई?
How to control bleeding?
हाँ, just keep a pressure on the same thing. It will stop again. Just give a small pressure, bleeding will stop on its own.
Tonight, patients are bleeding.
How?
After Raktamokshan?
No. Actually, the way I was cutting the vessels is just half yavan. Half yavan. Yavan यानी चावल समझते हो आप? चावल का आधा हिस्सा करोगी, चावल का आधा हिस्सा rice. Okay, just you have to cut only like half the part of rice. That is prachya karma should be a very minute.
Already stopped.
Now the blood is totally stopped.
We are getting bleeding up to 90 days.
You have to manage it because of that hirudin.
Actually, hirudin is
Because of that hirudin
is anticoagulant. So actually, hirudin, because of the hirudin, it bleeds sometimes. It is an anticoagulant. But here there is no, so that's why I am just telling you that this process is more superior than the leech application. Actually, here no chemical is induced inside, and simply we are performing by simple method. And our pain, the Dushit Rakta is coming out, and patient is getting instant relief.
The syringe having the only second power.
Yeah.
Syringe.
Yeah. Syringe already creating a vacuum.
Second power.
Yeah. Second power.
When we
see this syringe. See this syringe. How it is prepared?
So, sorry, Rajguru sir, can you just explain how to prepare the syringe for the demo?
I can't give you a demo, but I can say this was the syringe. There is no nozzle. There is no nozzle.
We have to remove the nozzle.
We have to cut the nozzle. Then just उल्टा करके एक पिस्टन उसको लगा देना है। जहाँ भी आपको रक्तमोक्षण करना है वहाँ खाली कट्स देके फिर इसको पहचान कर्म करके छोड़ देना है।
That already creates
और
a negative pressure.
सबसे पहले ये पिस्टन में एक होल करके रखना है आपको। ये पिस्टन में पहले होल करके रखना है 5 ml का ये लीजिए क्या बोले मेजरमेंट लेके 5 ml का मेजरमेंट ले लो और इधर होल करके रखो, ठीक है। यानी कि जब भी आपको करना है पेशेंट को इस्तेमाल करना है तो उसके सामने आपको झिझक नहीं आना चाहिए, क्योंकि यू कांट हेजिटेट in front of the patient. You must be looking very confident in front of the patient. But if you are not confident, then patient will never accept you as a doctor. First of all, you have to prepare yourself very promptly and very confidently. Then you undergo all these procedures.
What is the list of punching the needle? What is the limit of punching the limit?
Already I have mentioned. Half a rice. Second thing.
That is not it.
So
Syringe.
Catch this.
You are telling that you have to punch it in 5 ml.
Through and through.
Okay.
Through and through. You can keep that needle. Okay. सबको दिखाओ। ये प्रैक्टिकली सेशन है।
The practical session in which you just
you get all the idea now.
You can do it.
ये ठीक करो। हाँ, रिलैक्स करें तो कोई बात नहीं। अभी आपका कुछ आपका भी करेंगे। आपका भी करेंगे ना।
Tissue paper in back side. कैसा लगा आपको? How you think about this practical session? कर लेंगे ना आप लोग ये? करेंगे आप? कर सकते हैं पर सावधानी से करिएगा।
आप करते रहना। एक
with patient consent and
patient's consent is very important.
Yes.
Patient consent is very important.
In Kolkata, मैं बताता हूँ आपको, in Kolkata where is the mic? In Kolkata, we had a plan session. And so many. Okay, one thing I have to clarify you. There are so many type of patients, and in Kolkata previously, same doctors we are doing the Marma sessions as well as the Rakta Mokshana sessions. So many patients of the Parsi who backache they came here, and we told them, "Are you ready to do the Rakta Mokshana?" No, 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 वो नहीं करने का, ये मरमा करने का, ये सही है. They don't want to do this magic technique, but I salute to.
As a land area, which places right to the motion.
Yeah, this is a very good question. I explained that nearby the Marma, all the points is mentioned like Gulf Sandhi, Nikat the Gulf Sandhi, Nikat the Janu Sandhi, Nikat the Simanta Sandhi. All the points are well defined. These are not actually the Marma points. It is nearby to Marma points. If you just do this procedure, then you will get the results.
You can do the surface of each.
Surface margin, yeah. Yes, always remember that directly in blood vessels, if you puncture, then you get profuse bleeding. So nearby where the collateral supply is very less, in those Sandhi region, like Janu Sandhi, Gulf Sandhi, Shipra Sandhi, in that area you can perform it. Yeah, I got it. All the
Show mic, please.
Mic.
Now again the second procedure you observe, just get the mic. मजा आ रहा है आपको? You all are enjoying and learning by this session. And I hope after this session you can.
Take your complaints.
I'm feeling some like lymph or nodes. I'm not sure. Here I'm having pain. When I touch, whenever I touch here, I feel some pain here, and some small knots are there. Not sure what exactly.
मुझे क्या करेंगे ब्लड रीडिंग करेंगे
Ready, everyone. Okay. I am going to perform you and I am going to show you second procedure, that is Siraved. Siraved. Camera correct. I will describe you later. First, I will complete this procedure. Then I will explain everything. Okay? Just observe this.
Is it roti?
Keep pressure here over here. Okay. There was a श्लोक about Rakta Moksha in a Bhagavata that Kushta Visarva Pidana Rakta Pittam Asrudaraha Guru Medra Asya Pakasha Pliha Gulmo Atha Vidradi. So Pidaka बोले तो these types of small tissues or small granthis on her hand, and it was paining. It was paining. Now, what she says about her pain, just watch. Pain कैसा है?
I'm feeling now it's decreased. I'm not feeling pain, but still I feel small.
But it will definitely disappear. Up to
Yeah, pain is disappear. I'm not feeling any pain here. Pain is not. Okay.
But it will be disappear within tomorrow.
Okay.
Tomorrow itself it will disappear. Okay. Are you happy?
Yeah, definitely. I'm not getting what is the solution for this section.
Thank you, Dr. Shobha. Thank you for your patience and your very cooperative nature. Thank you. God bless you.
So thank you for all of you giving the opportunity to change my actually. Even this ankle also I'm feeling very free now. No pain, no stiffness. Feeling very.
Thank you.
Thank you.
Clap for her.
So at a time more than one we can do that angle.
What?
At a time more than one syringe we can do that area.
No, not necessary.
Separate.
Not necessary. Already survey explained you that Praman of that Marma is only one anguli. It's only one finger. Then why don't you use? Why are you using 2 series or 3 series? Not necessary. Not necessary. Okay? Got your point? Any questions?
Sir, what is the quantity of bloodletting, sir? Quantity of blood.
Quantity of bloodletting. According to Ayurveda, it must be more than 200 ml or 250 ml. But nowadays it is impossible to withdraw 200 ml blood. So I prefer to extract near about 20 ml, that is 1 or 2 tola, 20 gram is sufficient for one setting. You can add more settings also. You can add more settings also. For Sirave program, okay, for Sirave, you can add more settings. Any questions?
So instead of the second method, instead of wasting the blood, why should we donate blood? So it be useful.
Very nice, very nice, very nice. But if you want to donate blood, the quantity of blood is more than what you require.
But the therapeutic help will be there, sir.
It will definitely helpful, but there are some questions. I have not performed such a thing up to yet in my 35 years practice, because I am just doing 20 ml only. And if you are want to donate, it will be definitely more than 350 cc.
the first procedure, why not using the in the second?
This is a practical question. This is very practical questions. Okay. Okay. If you are Ayurvedic doctor, you are definitely known the pathology of the blood. Rakta is the second dhatu. It is a pravahi. It circulates through heart. Okay. Now she is having pain over here due to श्लोक कौन पूरा करेगा? श्लोक कौन पूरा करेगा? श्लोक कौन पूरा करेगा? कौन है? अरे कॉलेज से कौन है? अति प्रवृत्ति संतोहा सिरानाम मनतो अपिवा सही बात. निमार गमनम चापी स्रोतसा करेक्ट. तो उसका स्रोतस कौन सा दुष्ट था? रक्तवा. सही. उसका क्या हुआ था? संग. सही है. सही है. तो उसका संग हमने हटा दिया. Now she is painless, not painful. She is painless. अब आया समझ में? Now you can teach your students very confidently. Okay? Thank you, madam.
आप Part-3 का कौन सा प्रैक्टिस करेंगे सर?
हाँ?
आप Part-6 के लिए.
That is your choice. That is your choice.
आप कौन से लेंगे सर?
हम सिक्योरिटी भी इस्तेमाल करते हैं, हम सिक्योरिटी भी इस्तेमाल करते हैं, इंडस्ट्रियल चूर्ण भी इस्तेमाल करते हैं, वैश्वानर चूर्ण भी इस्तेमाल करते हैं, भास्कर लघु चूर्ण भी मिलता है.
रक्तपात के लिए सर
श्लोक दिया है ना?
रक्तपात
का जो है ना सेकंड नंबर का श्लोक है. कलिंगा पटोलस्य
पत्रम कटुकुरोहिणी
पटोल सारीवा मुस्ता पाठा कटुकुरोहिणी. पटोल सारीवा मुस्ता पाठा
कटुकुरोहिणी.
इसका पाठ मिलता है, उसका टैबलेट फॉर्म में आता है.
अंडर धातुगत ज्वर चिकित्सा.
पटोल सारीवा मुस्ता पाठा
धातुगत आंसर. धातुगत चिकित्सा, ज्वर चिकित्सा. All the formulations have been mentioned and it is practiced in Maharashtra as a धातु पाचक. आपको कैमरा पकड़ना पड़ेगा आज. No problem, no problem. You hold.
बोलिए क्या?
If you are tired, then you put the camera here.
हाँ बोलिए.
You can sit there. Yeah. Simply sit.
What do you want to say?
Can we do the first procedure, but this from monsoon years?
क्या बात करिए? सामने आओ पहले.
Just keep the camera.
Same question.
My question already answered. He answered. Sir, already he answered.
The question is very relevant. She's asking the first procedure what you did with the patient. Why you did not follow second time? Why you did Sira way? That is her question.
Yes, sir.
Sira way. I want to show you the Sira way. Okay. Second thing, this was the patient. This was the case of Sang, यानी कि obstruction in Sira. Okay. Got the point? So I want to remove that obstruction. So I perform Sira. Got your?
Okay. So many participants have been joined from Zoom also. I think 26 are also joined from Zoom. So anybody, you can ask your questions also through your virtual mode also. You raise your hand and I will unmute your mic. Yeah.
Please tell for Shaitika from where to do Rakta Moksha.
Usually, very nice and practical question. In my daily practice, I used to do the Rakta Moksha from this common peroneal vein. It's visible from here. From this ankle joint, it is visible. So you should have to tie over here. Then do the Rakta Moksha, see the result, and ask the patient to come for follow-up after 15 days.
Sir, one more question. Sir, if we see the Hijama process, there are 7 points mentioned for this bloodletting procedure. while in this tradition we are only doing the
I use it, but
and sir, for low back pain, the most commonest OPD in all over, most commonest this case of low back pain. Mostly we all doctors have low back pain patients. So how could
any one of you have a low back pain here? Any one of you have sciatica. Okay, then if you want to perform any procedure on yourself, so I am ready. No, that depends on your complaint and on your choice. Come here. Come here.
My name is Roshna. I'm applying from low back and the side reflex radiating pain. Since left leg.
For how many days?
Since 8 months.
Since 8 months. Okay. At what time you are getting pain?
All the time, and in early mornings and after getting up, I'll be working for longer time, standing and doing some work. At home, when we stand and it's not cold, I can move it.
So, do you have any treatment before?
Yeah, when I took my medical treatment, I was completely alright. But my daily routines, I travel for 30 kilometers on vehicle or else through bus. I used to go on my scooty, and now I again stopped and started traveling in a big bus. But still, it's I'm not able to have pain.
So, उसके पास ये she is having निदान also, she is having disease also. और हम लोग को क्या है खाली निदान परिवर्जन करना बहुत जरूरी है.
निदान परिवर्जन किया था तो completely cure हुआ था. But again I can't.
ठीक है कोई बात नहीं. We are going to perform Agni Karma. If she give me permission.
No, she will give
permission. If you want.
Permission is prior needed.
I will give all the explanation.
Okay. Yeah, I want to get out of this.
थोड़ा सा पढ़ा थोड़ा सा Actually, being ready, there are some problems. Definitely, I know that, but if she want to get a result, so
on that side.
She might pray. आइए
Camera is not working, I think. Working? Light is not coming. That camera. 1 minute. 1 minute. 1 minute. Now check the light is coming on that one. Yeah. Now it's okay. So participant now.
Question match
Examiner first.
Video.
Then I will.
Just wait. ऐसा डॉक्टर साहब पीछे
अरे करो ना जरा 1 मिनट मैं मार्किंग कर देता हूँ ना।
मार्किंग कर देता हूँ।
कहाँ पर है
माइक दे रहा माइक वेयर इज द माइक
यहाँ पर है
माइक किधर गया माइक
Mic.
इज द माइक This is the new demonstration on the Agni Karma procedure. You are now going to light. First, he is marking on the area.
I don't have pain here. Sometimes I don't have pain.
You all will visualize. Don't worry.
नीचे पैरों में सर
He just marking.
Actually, I was going to perform Agni Karma, but when you are saying it is radiating, I have to change.
What is in radiating what will you do and in the
See, this is common theory. Okay, we will undergo Rakta Mokshan from here. If it is radiating, we have to perform Rakta Mokshan. If it is not radiating, if it is fixed pain, then Agni Karma is helpful. If it is radiating, then Rakta Mokshan is.
it's radiating.
So radiating pain,
Not
Rakta Mokshan is there.
localized pain. I have a radiating pain up to foot. I don't have a stagnant pain at back. I have radiating pain.
Then we will perform the same. Okay.
तो रक्त मोक्षण तो किया ही है उसको सेम प्रोसेस है
Same Rakta Mokshan or
Yeah. ठीक है आप सो जाओगे
Actually, he is again performing the Rakta Mokshan. Actually, the pain is radiating. So the same procedure. Okay.
Camera.
इसी में क्या होता है मालूम है? इसी में क्या होता है मालूम है? सीरा संकोच
ये तो आप लोग भी कर सकते हैं अभी आपको मर्म दिखाएंगे वो तो इतना कर रहे हैं हम ना इससे कर देंगे
So one thing you observe that when radiating pain is there, he selected the patient for Raktamokshana, and when second pain is there, he told about the Agni Karma. This is the important point. It should be noted. So this is a live workshop in which you all are just now going to know the procedure of the the procedure of the Raktamokshana. So always take consent with the patient. Everybody is taking the view clearly in the screen. Yeah. So also give a clapping for our camera person who is holding the camera. He also concentration is very good. Continuously, who is just assisting us on successfully completing this session on Trishul. And also to all the 56 participants who have joined on the Zoom. 56 participants are indirectly just getting the knowledge of this session.
Cell phone का कैमरा लगाओ सब लोग एडिक्वेट सही है आपका नाम मैडम डॉक्टर नागरत्ना you are from
So we are conducting this session in Trishul, Kerala, and I hope that Ayush Darpan Foundation is concerned continuously conducting this session. This is our second program in Trishul, Kerala, the land of Ayurveda. And I welcome to all of you, and you are just participating in the live demonstration of the Raktamokshana. And so we welcome to all of you.
मुझे विजिबल होने दो पहले फिर बाद में आप जब पास
Please silently observe the screen how to do the procedure.
आप डर गए क्या
And Vedi Ramesh Rajguru is doing very good job. Along with Professor Vijay Dadam is also present here. I also welcome to him and salute to him. So continuously motivating this session.
No. Already here.
Searching for nerves.
Not nerve.
Not nerve.
Vein.
Puncture the nerve, finish. Vein.
You have only one chance. You have only one chance, not more than one. So be careful about.
So also give a big hand to our doctor who again give a consent for this bloodletting procedure. उनके लिए भी ताली बजा दीजिए जरा सा। वो नहीं होते तो आप कैसे देखते हैं? Please close the camera. Please close the camera. It's very good. You are also doing a very great job. Please the front person.
मैडम पीछे तो
मैडम थोड़ा सा
अरे रुको ना 2 मिनट वो काम कर रही है ना अच्छा क्या काम है अभी बोलो उसको चल रहा है कैमरा उसके पीछे
கால்ரே தெரியுது நான் பண்ண முடியும் நான் மூஞ்சிட்டே பார்க்கணும் கால்ல நான் முடியும் இருக்க தெரியுதே காமிக்க முடியும்
He's not a cameraman, he's a very intelligent person. You learn and you learn how to do the Raktamokshana. That's why he is just doing this. And I salute to him as he is very helpful and he is very cooperating us for conducting this session beautifully. Very beautiful picturization and live demonstration of the Raktamokshana in Trishul, Kerala, a land of Ayurveda. So Vaidya Ramesh Rajguruji is just searching the proper vein from where he punctured and he just removed the, just look, he tied. This is actually the Shiraved technique. This is known as Shiravedam. Shiravedam.
Yes, we got it.
Not getting any behavior. Not आपका वेन नहीं दिख रहा है
very less water. ज़्यादा lighting रहे तो भी नहीं दिखेगा सर.
वही तो हो रहा है ना. Please camera.
Yes,
Please
camera.
Please
Camera on the camera. Yes. Just look how he just Shiravedam. This is now he is doing Shiravedam. Ramesh Rajguruji, blood is now coming out or not?
Yes.
Yes. So, Doctor Saab, hello dear. Dear sir, kindly focus the camera on that side. Is it possible?
Sir, length
Is very short. Okay, okay. Just I am just. Okay, no problem. जितना दिखता है उतना ठीक है, पता चला ये भी नहीं दिखेगा. So anybody can join the Zoom sessions from their side. This camp. In your mobile, Zoom is there. Zoom. You can join. I have shared the meeting ID and password, so you can just. Yeah.
Mike, please.
Mike, please.
No, if you join through Zoom,
This is for the case of Saitika. So relating live. So it was very unlucky to get rain from our lake. So we find out one vessel, and blood is coming out very slowly. That is, in the vessels there are a lot of bubbles inside. It means that is water dominant sciatica that causes a radiating pain. Sorry. That's all. Okay. ज़्यादा कुछ नहीं करना है. हो गया अभी.
ज़्यादा नहीं करना है. अभी परफॉर्म डेमो देना था. डेमो दिया है.
नहीं सुनो. चॉकलेट नहीं चॉकलेट कलर थोड़ा ऐसे रखो ऐसे. Bring all the box here. ये जरा साफ करके लाना बेटे. अरे भैया साफ करके लाना.
Slow, but it's what it is.
Is it visible? Is it visible? Is it visible? Is it visible? Is it visible now? We are going to perform with the karma on this patient. With the number. This is 21 number needle. We are going only half an hour inside her skin, and it will definitely help her. If Raktamokshan is not possible in any patient, then we have to undergo that patient with this type of with the karma only. Madam,
24 number needle. Observe this only here. Just you have to observe. Just here you have to observe. Stimulating the marma points only. With this needle. Okay. Can you lift your leg? Can you please? Why are you fighting? I think.
No, I can lift my leg.
Yeah. You can lift your leg. Do you feel better than before?
Better results. Now she is able to get.
Do you feel better than before?
Yes, sir. Yes, sir.
जोर से कहो.
Cotton to cotton.
Not necessary.
Alia,
Not necessary. Just lie down for 5 minutes and then you will definitely all right. Okay. Someone can clean her face. She's very
Scared.
yeah. She's very tired and she's very
21 meters.
needle number 24. If you are Ayurveda graduate, then you can understand everything. But if you are not Ayurveda graduate, you will never understand this procedure. This is a total pure Ayurveda based procedure, marma points, and this is based on Ayurvedic knowledge, Ayurvedic approach. We are going to stimulate the marma points. We are stimulating the marma points and asking for the results. If you are non-Ayurvedians, you will never get this idea. So you have to study Ayurveda book first. Then you don't have any questions. Got the point?
Get admission in college. Get admission in college.
सब आपको कल आ जाएगा. तो मरमा सब आएगा कल. Actually, congratulate her to prepare herself for demonstration. हाँ, उसको पहले congratulate करो.
Thank you, madam.
महिला हो के भी.
She will be taking bus day. So that she will take bus day.
So I think that this procedure is now completed.
Her procedure is completed and now she is giving her confession about the procedure and about her disease.
So now just come and you are just take your seat. Please take your seat. आप अपना पकड़े रहना है इसको.
Actually, before she undergone Panchakarma in her college, and now we are just performing Rakta and Nitya and see what she said after this procedure.
So, madam, what's your name? And you are so many persons are watching in Facebook and also the Zoom, and also there are 50 approximately participants are here. So please sit down here. Please sit down here. Just go there and try to. Just look, he is now comfortably moving. Is there any better? So you just explain it directly to all our participants. What is your the problem and what relief you just just observe in this one city.
Just introduce yourself.
Myself, Dr. Nagarjuna also. I'm working as a medical officer at Nagari District. I travel 30 kilometers on vehicle or else in bus. But each day when I travel, I surely get pain, and in the evenings it is too much stressed and all. I also need rest at least half an hour daily. But now, whenever I sit or get up, my mind goes to my leg. That much of disturbance it was there. At present, after this procedure, I am not feeling that discomfort. But I want to observe it till tomorrow, and again I want to explain myself.
So tomorrow is also here. She is also here.
But I am feeling much difference here. Before lying down there and after getting up from there, at least I am having some changes I am finding, and I want to observe it tomorrow, and I would like to explain on it.
Give a big hand to her.
Thank you, Dr. Nagarjuna. And definitely we are expecting a good result tomorrow also. After one sitting, if she is getting good result, tomorrow she will talk to us, and definitely she will tell about her problem and about her problem. Definitely, and we are expecting you. Okay, thank you.
Thank you.
Thank you for your support.
Okay, I can say that our Grantha are definitely showing us a very good path for the treatment of such things. Thank you.
Thank you very much.
So for a very beautiful session, you just sit because you have to hold the camera. So you are the key person. Actually, you look that 53 persons are watching this through the Zoom, and I think that this session is live in Facebook also. So many of the people outside India also watching this session. So now the Vaidya Ramesh Rajguruji has already practically demonstrated the Shiraved technique and how to do the Rakta Mokshana without any tam jham, that is called tam jham, without many instruments. So very nice presentation, very nice. Tomorrow you also do some live session. I think that किसी को सिखाएंगे इधर कल चलेगा कोई करेगा आप में से कल कौन करेगा who will perform okay so you perform दो लोगों को तैयार करना पड़ेगा क्यों डॉक्टर साहब एक जो करेगा और जो एक कराएगा तो हाँ
Anybody who wants to do this karma should have to bring 20 ml syringe on his own. Then he has to bring the scalpel set number 20 or number 23 with himself. Then he had to select one patient from all this audience. Selection of patient is very important, and consent. Boost your confidence first. Boost your confidence. That is very important. Okay. I think one doctor was having problem over here. I think.
That doctor coming from Hyderabad.
कोई डॉक्टर है ना वो हैदराबाद से लगे क्या नाम है उनको टीटस तो ये क्या है विज्ञान परफॉर्मेंस
पूछ लेंगे सो थैंक यू अग्नि कर्म हम कल रखेंगे आज हमारे सेशन में रक्त मोक्षण का प्रैक्टिकल कल भी तो है ना आज ही सब सीख लोगे तो कल के लिए क्या बचेगा कल भी पूरा प्रैक्टिकल है तो टुडे नाउ आई 5 बजे तक सेशन है हाउ मच टाइम इट्स 4 o'clock to 15 minutes हाँ तो 1 hour is there so I have to complete the upper extremity marmas and then tomorrow we also show the hands-on training on marma so I hope that first of all we have to complete this session so all are ready so now I start now the ansa marma the next one is the upper extremity marma the ansa marma. Ansa marma are 2 in number. It is very beautiful, especially for frozen shoulder patients. Ansa, A-N-S-A, ansa. It is 2 in number. It is a snayu marma. Snayu. Ansa, NSA, Ansa. Ansa Marma is a Snayu Marma, and it is located in the just behind the clavicle. And how you can examine the Ansa Marma? So Vijay ji, you just come here and just sit here. So it will be very clear to show you. इधर बैठ जाइए आप.
यहाँ नहीं लगा सकते आप? कुर्सी कुर्सी को लगा सकते हैं?
यहाँ पे बैठ जाइए. ये इधर बैठ जाइए. Close up
पकड़ के बैठने के लिए
नहीं वो बैठने नहीं होगा. Yes. So what is how we can locate this marma? So first you have to just, this should be at 90-degree angle and this should be at 45-degree angle, and the index finger should be at the junction of the neck and shoulder, and the middle finger where it comes, this is the point you just pick up, just press it, the point, just press it, you feel a pain. Again I am repeating, the shoulder should be at 90-degree angle, the hand should be at 45-degree angle, the index finger at the junction of the neck and shoulder, and the middle finger comes at just behind the clavicle at the ligament that is called coracohumeral ligament, that is the Ansa Marma. So this is a very good marma for frozen shoulder, especially for frozen shoulder. This should be at 90-degree. The back should be straight. No, it's very distant. You have to just, yes, nearby to it. Index finger should be at the junction of the neck and shoulder. You just very long gap. Yeah, this is the point. You have to just press through the middle finger. You have to press through the middle finger. Yes, your index finger should be at shoulder, and the middle finger comes at the point. This is the Ansa. This should be at 90-degree. This should be at 45-degree. The index should be at the junction, and middle finger comes at the point. This is known as Ansa Marma. 90-degree, 45-degree, index, the middle finger comes at the Ansa Marma. 90-degree straight, 45-degree, index finger, middle finger comes at the Ansa Marma. 90, 45, yes. Sit straight. Yeah. Always, whenever you are, yes, good. Yes, good. Good. So this is the Ansa Marma, and yeah. So how? Yeah. This is the 90-degree, 45-degree. The index finger at the junction and the middle finger. Yeah. No. Very distant. This should be at 90-degree. This should be 45. Index finger at the junction of the neck. This is the
adjustment. Yeah, adjustment.
90-degree, 45-degree. Yes. 90-degree, 45-degree. Yes. Slightly put your index finger near. Yes. Good. Yeah. Slightly. Yes. Index finger slightly more. Yes. This is the point. This is the point. Snayu. This is the point. Yes. हड्डी के ऊपर पीछे की तरफ. Yes. 90-degree. 40. This is the painful part. Yes. Snayu marma, and it is a very beautiful marma for frozen shoulder and for many Ansa soul, Ansa soul, Ansa jadakya. In all these conditions, this marma point works. And similarly, if any patient who is suffering from frozen shoulder, bring him or her here in one sitting, I will give you the results. किनको? हाँ, अब क्या है कि कपड़ा खोलने की बात कर रहे हैं. विजय जी आप तैयार होंगे क्या? विजय जी शायद होंगे कि नहीं होंगे मुझे नहीं मालूम. कंसल्ट ले लो उससे. अरे नहीं आपको नहीं, आपका नहीं कपड़ा उतरवाऊंगा मैं, आप हमारे एक्सपर्ट हैं. विजय जी का मैं कर सकता हूँ रिक्वेस्ट करके, लेकिन जो भी यहाँ पे वॉलंटरीली एनीबडी एल्स हु कम हियर, आई एम नॉट फोर्सिंग विजय जी, एनीबडी हु वॉलंटरीली कम हियर. विजय जी आप तक तैयार हैं? चलो कोई नहीं, विजय जी इज रेडी. आप भी तैयार हैं वैसे? नहीं विजय जी कहेंगे. हम इनको आप मार्किंग करके दिखाएंगे हाउ द marmas should be located. So just look, I am just making a point, and this is very useful. Actually, the Agni Karma and Rakta Mokshana, if you want to be a cameraman, you just focus. If you will sit here. If you want to be an expert in Agni Karma and Rakta Mokshana, first you have to know about the actual Karma points. then you can very confidently you can do the Sira way. Then after just sit here. Yeah, बैठिए. ताली बजा दीजिए एक बार. लेकिन कोई नहीं आता ऐसे. या आपके लिए आए हैं. केवल आपके ज्ञान के लिए आए हैं. The person is just he's a very doctor. He's a BMS doctor and training AI मैंने मुझसे. He's from Hyderabad and he just came here for you all people. So just 90 degree and 45 degree and just look the point. The middle finger comes. This is the point. Just remove. This is the point. Yes, just close the finger. Just close the camera. Close the camera. So this is the point, and how you have to stimulate. You have to, if you want to stimulate this point, so you have to just come backward. You can perform in this way. इधर अंगूठा रखने का, ऐसे दबाने का, छोड़ने का. Press, release. Press, release. Press, release. Press, release. 0.8 second, 15 to 18 times, and I am just assuring you that in frozen shoulder cases, you got immediate results without any invasion. So again, I am repeating how to locate this point. The shoulder should be at 90 degree. Never do Marma stimulation in standing position. Remember this fact. Always do this in sitting position or in lying down position. Shoulder should be at 90 degree. Shoulder should be at 90 degree. Hand should be at 45 degrees. Index finger should be at the junction of the neck and shoulder, and the middle finger comes over this point. That is the coracohumeral ligament or glenohumeral ligament. That is known as the Ansa Marma. Okay, so Ansa Marma is also a Snayu Marma, and it is also a Vaikalikar Marma, and definitely this Marma is very and half angular pramana, and this Marma is very effective for frozen shoulder movements, as well as it is also a substitute Marma of the neck region. Actually, the neck Marma can never be directly stimulated. In the Kalari here in Kerala, I met some Kalari people. Even there are so many students of Sanoj, and so a video also there in which he is just pressing the neck Marma of cock as well as some goat, and that is the goat or cock or animal is just unconscious. So actually what they are doing, they are just continuously pressing the Matrika Sira Marma, and by pressing this Marma, the brain blood supply just got obstructed, and the brain is not getting proper oxygen supply, and that's why the unconsciousness comes. And after 15 to 20 seconds in that animal, he just pressed the Brihati point, and after that the animal just got consciousness, resumed the consciousness. But I never advise doing human. Actually, when I got in his home, he also presses this point, and after 1 or 2 seconds, I also got delirium. So I never tell you, and I suggest you never do the neck Marma stimulation directly. Then there is a question that how the neck Marma should be stimulated. The neck Marma should only be stimulated by two ways: the positive pressure technique by this, just making you're just holding the air, gal pulalo, and just protrude your tongue by this way. Yeah, but the Ansa Marma is the substitute of the neck Marma. So if you are not able to stimulate, because directly it is not allowed to stimulate the neck Marma. So the Ansa Marma is a substitute of the neck Marma. So the clinical effect is it is also affecting on the vocal cords, on the Vishuddhi chakra, and so the stammering cases or for the thyroid cases. And I already explained, you just note down it. For the frozen shoulder cases, it is very effective. Thank you, sir. Now come to the next Marma point. I say somebody else, not Rajguru ji, hold the mic. कोई आएगा? आप आ जाओ, क्योंकि अभी बहुत देर तक चलेगा ये. 1 घंटा चलेगा, 5 बजे छोड़ूंगा. So this is Ansa Marma. It is now clear. Yes. So Ansa Marma acts on the, this is which vayu is sthana? The neck is the sthana of Udana Vayu. So Udana Vayu's function is, you all know the guy and the I am just working through my Udana Vayu. Actually, I am just giving speech from 2 or 3 hours. So definitely this marma is very important for those who practice of the Gayan, or they are leaders or good teachers. They must stimulate this. They must have to stimulate this. So this is the answer. Now come to the another marma point. Just you measure the shoulder joint. This is the shoulder joint and this is the elbow joint. Just measure the distance from shoulder to the elbow joint. Just measure. How much angular pramana? Just tell me. 4, 4, 8, 4, 12 and 4, 16. It is 16 finger unit from here to here. Just measure it. Maybe in Kerala it is different. Kerala people. But God has given a similar distribution to all over the world. So there is no difference. So just 16 angular pramana. So between the elbow joint and shoulder joint, at the 4 finger pramana, 4 finger unit, I already explained that the finger should be taken, the measurement of the finger should be taken according to the patient size. If a patient is small child, the size should be taken according to the size of the patient. So at 8 angular pramana, either from the elbow joint, 4, 4, 8. So this point comes here and this point comes here. 8 angular pramana at the mid of the shoulder and elbow joint. 8 angle from here and 8 angle from here. This is known as the Urvi marma. Urvi marma is also known as the Bavi marma, as it is near to the shoulder. And if you virtually draw a imaginary line between both the marma, you look at which organs come above the chest region, means the lungs, the cardiac region, the somewhat region of the kantha also. So this marma has a very positive effect on healthy tissue generation. Means if you want to regenerate your cells very fast, or you want to yourself keep away from the cancer-like conditions, then you must have to stimulate this Urvi marma. So Urvi marma is also 1 angular pramana. It is a snayu marma and it is at the 8 angul pramana from the elbow joint to shoulder joint. And it is an effect on the chest region, upper chest region, you can say. So this is which type of marma? This is also Saumya marma, and all Saumya marma are Vaikalya. I explained that all Agneya marma are Sadhya Brahmana. Okay, all Saumya marma are Vaikalya. All Saumya Agneya marma are Kalantar Brahmana marma. All Vayu Agneya marma are what type of? That is the Ruzakar marma. And all the Vayu Mahabhut Vayabhya marma are the Vishalyagna marma. Vishalyagna marma are only 3. 1 is Thapni and 2 Utakshay. Very nice. So maximum of the marma are Saumya and they are Vaikalya. And in the same the Urvi marma. Now come to the next point. Just 4 finger below the Urvi marma. The next point is the Ani marma. Ani. This is the Ani, straight line. This is the Ani marma. And if you draw a virtual line between both the Ani marma, you find that the chest, lower area of the chest, the spleen, the liver, and the pancreas, all the points, as well as the kidneys part, also kidney part. You just virtually draw a diagram, virtual line. So kidney, all the parts comes over this point. How to stimulate? The question arises. How to stimulate? Yes. Yeah, benefit of the Urvi, healthy tissues generation, or we can say that to avoid the cancerous cells, we have to stimulate this Urvi marma. So this is the Urvi marma. And now come to this is the Ani one. This is the Ani. So it works at the lower part of the chest region. So the area, the liver, the spleen, the pancreas, all the areas, vital areas comes over this marma points. So this is the Ani marma. So Ani marma and Urvi marma and the Ansa marma, these marma points are stimulated in certain condition in sequence. Like in frozen shoulder. Only Ans Marma is not stimulated. We stimulate Chipra, Kurpara, Ani, Urbi, Ans. This is the sequence. I will explain you. Now I am coming to the Kurpara also. So this is the Ani Marma. Ani Marma is a Shira Marma. It is also a Shame Marma, and it is Vaikalikar Marma, and it has a positive effect over the chest region, in the lungs, in the lower part of the liver, the gallbladder, the back, the posterior part of the kidney. So in each organs, it has a positive effect. Okay, so Urvi and Ani Marma. Both Marma I already explained. Both Marma are in the similar line. Again, I am repeating. Urvi Marma is 8 angula pramana above the elbow joint, and Ani Marma is 4 angula pramana above the elbow joint. You can just mark your Urvi and Ani simply by putting your head, 4 fingers in this way. This is the Ani, and above Ani, this is the Urvi. Clear? Now come to the next point. It is very important. It is very important. It is known as the Kurpara. Kurpara, Rakta Mokshana. The Rakta Mokshana, Kurpara Sandhi. In which disease, Dr. Rajguru? Kurpara Sandhi. Kurpara Sandhi, Rakta Mokshana. Yes. You know that Yakrita Vyadhi. Yakrita. It means the Kurpara Marma is related with the liver. You can say that how it is associated with the liver. I will just giving you a tips that if you want to correct the metabolic system of the body, you know that nowadays lifestyle disorders are very common, and so many people are suffering from lifestyle problems. Do you know the lifestyle disorders? 3 disorders: diabetes, the obesity, as well as the hypertension. These 3 are the lifestyle disorders in which the Kurpara Marma very well, it acts very well. So how you can just locate the Kurpara Marma? So this is the epicondyle. This is the medial epicondyle, and this is the lateral epicondyle. So always remember that from the medial epicondyle and from the lateral epicondyle, you have to just go beneath 1 finger beneath. So, Dr. Vijay, if you have any doubt, you tell me that I have some doubt about the point and stimulation. You can ask. कोई प्रश्न तो पूछना. So this is the point. This is the Bahya Kurpara. This is the Abhyantar Kurpara, and this is the Bahya Kurpara. How you can locate? The method is that you have to put your thumb at the oligrenon process, and you have to put your index finger in this way, and the middle finger comes, that is the Bahya Kurpara Marma. Again, I am showing you. You have to put your thumb at the oligrenon process, put your index finger at the crescent of the elbow joint, and where the middle finger comes, that is the point. This is known as the Bahya Kurpara Marma. Clear? Again, I am just straight your hand. Put your thumb at the oligrenon process. Put your index finger at the crescent of the elbow joint. Crescent of the elbow joint, and your middle finger comes at the point. Middle finger, look, middle finger. You just point this point, mark this point. This is the Bahya Kurpara Marma. So this is the Bahya Kurpara Marma. And at the same virtual line, if you come at the medial side, you find the Abhyantar Kurpara Marma. Now I am just doing the stimulation. How you stimulate this marma? This marma is very effective. In many cases, even I am just saying you, in the heart disease as well as there are so many conditions where the metabolic disorders like clotting of the bloods, like thromboembolus formation, all these conditions, this marma is very important. I will locate you, don't worry. You are doing wrong. I will locate. Just look. You have to make your hand straight. This is the point. The point. You have to put your thumb and just put your index finger at the oligrenon process. The middle finger comes. This is the Bahya Kurpara. And in the same line, this is the Abhyantar Kurpara. Just mark. Put your index finger at the elbow joint spaces. Yeah, oligrenon process. Elbow joint spaces. Middle finger comes. This is the
Bahi Upara, and at the same line, the abductor with straight hand should be straight. Median anatomy. Median, yes. This is the lateral. This is just put your thumb and and at the same line, put your thumb and olive on the process, index finger at the places, middle finger comes where, right, at the same line, and start. Yes. Hands should be straight. And at the same part, put your thumb and the olive on process. Index at the places. The index finger comes, middle finger. तो हम करके दिखाएंगे और आप लोग एक दूसरे का करेंगे। कैसे करना है देखिए आप पहले, जस्ट फोकस द कैमरा। एक दूसरे का कैसे करना है, गलत करेंगे तो हम करेक्ट करेंगे, ठीक है? तो देखो यहाँ पे ऐसे नीचे हाथ रखना है, ऐसे हाथ को ऐसे रखना है। You have to put your hand in this support. 1 minute, just a stump. Okay, this. So this is the bahir. This is the bahir. So you have to support your 4 fingers below the elbow joint, and this is the bahi. You have to put pressure.
Back.
I think that there is some. You are. आप चला रहे. You have to press it. देखो दर्द होता है, कस के दबाने का अभी दिखाएंगे आपको करके एक दूसरे का. This is the point. You have to press it. This is the press it, and in the same way, and you have to press like this. तो अपने को इधर से ऐसे करना है और इधर से ऐसे प्रेस करने का. दर्द हो रहा है? You are feeling pain? Yes. अभी करके दिखाते हैं.
So can we stimulate 2 points at a time?
Yeah, at a time. You can stimulate 2 points. I am just doing. Just क्या इधर आओ, बैठ के. यहाँ बैठो. अभी एक दूसरे करना है आपने. देखो कुछ नहीं करना, मार्किंग करने का भी जरूरत नहीं है. Just this is the आभ्यंतर. You have to do this. अगर किसी का हाथ नहीं उठ रहा हो तो अभी बताओ, अभी हाथ उठा के दिखाते. किसी का है यहाँ पे हाथ फ्रोजन शोल्डर? Who is suffering from frozen shoulder? ये है. हाँ अभी बुलाता हूँ इसको. अभी सामने आओ इधर. आओ इधर. और शर्माते काहे को? शर्माना नहीं है. आओ इधर. ठीक है, आप बैठो. ये ऊपर करने. जरा इनका नाम बताओ भाई, किधर गया? माइक. हाँ
सर दूसरा चेयर दीजिए.
इधर दूसरा चेयर दे दीजिए. आइए. गुंटूर से आए हैं ना आप? गुंटूर से. नाम बताइए आप अपना. हाँ रफी जी, मोहम्मद रफी. गायक थे ना बहुत बड़े. आप अपना हाथ ऊपर करो तो दूसरा हाथ करो. दोनों हाथ करो. तो अभी तो इतना प्रॉब्लम नहीं है वैसे. अभी तो पेन नहीं है, तो फिर क्या दिखाएं? नहीं वो तो आप कहोगे कि ठीक हो गया है. ये केस नहीं है वैसे फ्रोजन शोल्डर का. हाँ खाली डाउट है, अब तो ठीक हो गया है. लेकिन मैं बता देता हूँ, चूंकि ये आए हैं तो हमने क्या करना है. व्हाट वी हैव टू डू, वी हैव टू फर्स्ट स्टिमुलेट द क्षिप्र मर्मा. आई विल एक्सप्लेन इट. देन कुलपर मर्मा. हाउ टू डू द कुलपर मर्मा. पकड़ो. कुलपर मर्म कैसे करना है? देखो एक बात ऑलवेज ध्यान दीजिएगा, ये ओबेस है, ताकत ज्यादा लगाना पड़ेगा. एंड कुलपर मर्मा इज अ संधि मर्मा. रिमेंबर. तो इन संधि मर्मा यू हैव टू गिव मैक्सिमम बेरेबल प्रेशर. इट इज अ संधि मर्मा having 3 finger 3 angula pramana, and it is also a vaikalika marma and swami marma. But you know, if you observe that, just Vijay just come straight. Yeah, stand. आप अगर दोनों तरफ के कुलपर मर्म के बीच में लाइन खींचो आप, both the कुलपर मर्मा, if you draw a line, देखिए कहाँ आ रहा है? किधर आ रहा है? This is the part associated with the kidney. This is the part associated with the right side, right hypochondric region, liver, gallbladder, spleen and pancreas, all the vital parts, all the parts which are associated with the metabolism. नहीं, liver का role है कि नहीं है metabolism में? Do you know the importance of the liver? Liver is a storehouse of enzymes. All the enzymes are stored in the liver. So once liver is not working, the digestion is not proper. So the liver functions, it improves the liver functions. Even the fatty liver cases, this is a very beautiful marma. So the Kurpar marma has a direct effect on the liver, gallbladder, but always keep this in your mind that right Kurpar marma is effective on the right, more effective on the right sided organs, while the left Kurpar marma is more effective on the left sided organs, that is the spleen and the pancreas. So always remember that in healthy persons, like this fellow who is saying that I am suffering from last some years for the and now get some relief. करना पड़ेगा. हाँ करना है ना, तो ठीक है. अभी तो आपका हाथ तो ऊपर जा रहा है. आपका 2 दिन तो हाँ तो ऊपर मर्मा you have to. आप कैसे करेंगे इसमें? कौन करेगा इसमें? हम ही नहीं करेंगे. Any person कोई आओ, आप इसे करके दिखाओ. हैंड्स ऑन ट्रेनिंग है ना, आप करो. चलो आप आओ. कुलपर मर्मा सिखाएंगे सबको करना, चिंता मत करो. इधर प्रैक्टिकल डेमोन्स्ट्रेशन के लिए आदमी तैयार है. हाउ यू हैव टू स्टिमुलेट द कुलपर मर्मा. Yes, always remember that camera focus here. Yeah. Points already marked. You have to straight the hand. हाथ सीधा करने का, इधर सपोर्ट लगाने का, इधर हाथ पे सपोर्ट लगाओ, आगे आओ, इधर आगे आओ, सपोर्ट लगाओ, ऐसा, और ये अंगूठा ऐसे लगाओ, ये पॉइंट, हाँ, इधर ये लगाओ, आप कस के दबाओ, ये तो चेहरा बदलना जाना चाहिए इसका दर्द से, चेहरा तो कुछ बदल ही नहीं रहा है, मोटा है ना,
दर्द आपका चेहरे से दिख नहीं रहा है, वैसा होता है,
ऐसे दबाना है, छोड़ना है, प्रेस रिलीज, कोई बात नहीं, वो यूज जो है, ये बाई ऊपर किया हमने, अब इधर आभ्यंतर करेंगे, तो कैसे करेंगे, इधर से ऐसे नहीं, अब हम इधर से क्या करेंगे, ऐसे नहीं, हाँ, अब ये इधर लगाएंगे, नीचे, कस के दबाओ, you just observe that sometimes when accidentally this part is heated, you feel a current, jerk like a current. The same point. This is the yeah. You have to stimulate the bicuspid and abhyantara. So this is very important for breath detection. ये bicuspid है ना, अपना अपना करिए, इनका करके देखिए आप मैडम. Yes, ऐसे. Yes, press it and release it. Press, release. You have to give pressure. You have to lift like this. सब होता है. ये याद रखिए. आप इससे कम दोगे ना, कुछ नहीं होगा. रिजल्ट नहीं मिलेगा. ये तो स्वस्थ है ना? मैंने बताया सैंपल. This is ऐसे करो. Do it. Yes, stimulate it. No, don't remove your finger. You have to just do it rhythmically. Press it and release it. Press it and release it. Press with force, little force. You just Shanti Varma, don't worry. Yeah, that's good. And in the same way, you have to do in this side. Yes, press it. Yes. So, madam, if she will do it 3 times, or you herself do it 3 times, we will got on your the next time, definitely. आज ही बात में जाएगा. How you can do the Ansimarma? Just show it. You have to go back side. देखिए ये Ansimarma करके दिखा है. देखिए. ना. Hand should be straight. Yes. And your position should be in this direction. Yes. Present and release. Yeah. किसी को बदला लेना हो तो वो भी अच्छा है. दोनों एक साथ कर सकते हैं, क्यों नहीं कर सकते? दोनों एक साथ ऐसे कर सकते हैं. देखो ऐसे कर सकते हैं, पर ताकत नहीं लगेगा, ऊपर से ताकत नहीं आएगा. सिंगल पॉइंट करेंगे तो ताकत आता है. सेल्फ वर्मा स्टिमुलेशन, अरे आपको आएगा ना, सबको नहीं आएगा ना. ताकत एक में पहले नहीं करो, फिर दूसरा करो. Points which one? Okay, now Upper Burma, you understand? Yeah, it is effective in diabetes. So those who are suffering from diabetes, hypertension, and obesity, you have to also do it. Simply, how you can do? This is the elbow joint stresses, and just keep one finger below. This is the full color. Yeah. You have to give maximum pressure. What happens? कुछ नहीं होगा, आपको चिंता मत करो. If you do like this, no, nothing will happen. This is the actual pressure. करूँ मैं, आपको घबरा जाओगे. देखो ये जो प्रेसेस है ना, फेसेस के पास से एक अंगुली छोड़ दो नीचे, बहुत सिंपल है और डिफरेंस एट ए टाइम दोनों दबाओ। तो क्या होता है ना, दोनों में ऐसा ताकत नहीं लगता क्योंकि ऊपर मर्म करने वाले का भी पसीना चल जाता है, ताकत। हाँ यस, सिंगल सिंगल, नो ऐसे नहीं, फिर आप ऐसे करके ये को आगे से ऑलवेज रिमेंबर दैट, जैसे पहली बार हो गया तो ऑलवेज गिव मिनिमम ये भाग जाएंगे दोबारा आएंगे। अगर एक पेशेंट हो गया तो ऑलवेज रिमेंबर द फंडामेंटल इज दैट इफ यू आर फर्स्ट टाइम encountering any patient you have to give low threshold of pressure because you have to boost confidence, and when the second time patient will come, she knows about the pressure, so she will not respond, and even sometimes the patient is just unwillingly she is doing expressions, then tell him or her to deep inhalation and exhalation, deep for diverting the mind. But actually, if you are not putting the maximum threshold of pressure, then you will not get the results. Actually, this is Sandhi Marma. Only Sira and Snari Marma should be carefully stimulated. Sandhi Marma and Asti Marma, you can give pressure. So always give minimum pressure. Daily, regular. Pressure shoulder, you will get results in 1 sitting, but you have to tell the patient to come and follow up in approximately 7 days. आप में से किसी को फ्रोजन शोल्डर सब चलता है इधर, आपको है हाथ ऊपर जाता है, उसका हाथ ऊपर जाता है, ऐसे हाथ आएगा। All I request all of you to raise your hands. हमें को चेक करना पड़ेगा किसको है, सब सही है, आप भी हाथ उठाओ, सबका जा रहा है, and straight, और ये सब ठीक है, इधर कोई मरीज नहीं मिला, everybody is okay. So in the cases where the hands are going upward, yeah, very serious. Yeah, it also works in survey. तो आपका इधर आइए, पेन लगता है, आइए, देखिए पेशेंट मिल गए हमको, तो काम करेगा, काम करेगा। अब देखो एक मिले हैं, पता नहीं ये कह रहे हैं कि आई एम नॉट एबल टू रेज माय हैंड्स प्रॉपर्ली, तो आप इधर आ जाइए रफी साहब, दूसरे को ढूंढ के लाए हूं मैं, आइए। माइल्ड पेन, देखो माइल्ड पेन है, शी इज अ प्रोफेसर इन कॉलेज, इन व्हिच कॉलेज?
SVM Medical College,
Karnataka. And he is suffering from some shoulder pain, so I advise कौन करेगा इनका आंसर, आप करो, चलो पीछे से जाओ, पीछे से जाओ, आप एक्सपर्ट हो, पीछे से जाओ, कैसे लोकेट करना है, तो पहले इनसे लोकेशन का मार्जिन लो, लगाओ वहां पे, हम just do shoulder 90 and 45, this is the answer part. आप करो, just do the answer part. Look, the rhythmic way of stimulation, 0.8 second, press and release, press and release, press and release, 15 to 18 times. अभी देखो इनका पेन अभी कम हो जाएगा, मैंने नहीं किया है। If you bring a patient who is suffering from cerebral palsy, then there is spasticity, you immediately got result. In such cases where there is no treatment, no management, the Marma Chikitsa excellently works. So I always request all of you, don't take it lightly. This is a great gift of God for human mankind. अब हाथ ऊपर उठाओ, देखो सर कुछ दर्द पहले से कम हुआ है, देखो कम है, अभी ये हाथ को उठाने में थोड़ा चेहरा बना रहे, अभी कुछ नहीं किया, इनका अंश मर्म किया, देखो अब मैंने भी नहीं किया, ये विजय ने किया।
अगर शोल्डर एक साइड पे होता है, दोनों साइड पे करना पड़ता है,
दोनों साइड ही करना पड़ता है, you have to do both sides. So thank you, give a big round of applause to Professor साहब। तो आपने ऐसे करना है, इधर हम खाली आपको डेमो दिखा रहे हैं, और what is your problem? Pain here, just raise your hand, देखो ये को ले जाने में दिक्कत हो रही है थोड़ी सी. You are feeling pain in lifting your hand. So remember that मर्मा should be. Who will stimulate? कौन करेगा? आप करेंगे. तो अंश मर्म करो इनका. You just do the अंश मर्म. First of all, locate the मर्मा. Yes. The back side. The index should be at the. Yes, this is the point. You just do it. Do press and release. Press, release, press, release, press, release, press, release. Press and release. Yeah, press, release. It is Snayu Marma, then so that's why you have to give careful pressure over this point. Press, release. Yes, zero. Not don't remove your finger. The finger should be there because you have to. कभी-कभी क्या करते हैं लोग अंगूठा उठा के ऐसे से करते हैं. No, don't do. Just rhythm. Just do in the rhythm. So this is the Ansa Marma. Yeah. Do it frequently, 15 to 18 times. So always you understand the Ansa Marma stimulation, Urvi Marma stimulation, Ani Marma stimulation, Kulpar Marma stimulation. Now, yeah, cerebral palsy. Is there any patient? Where the patient? Huh? इधर गांव में होंगे जिधर आप करते हैं. इधर नहीं है. पालाकाड से आई थी मैडम. आपके उधर है सेरेब्रल पाल्सी. अरे आप रुक जाओ अभी.
शरीर का
कम हो गया पेन?
बताओ क्या हुआ? पेन अभी पेन था इनको. अंशमर्म करने से
पेन रिड्यूस हुआ. ताली बजाइए. तो ये these are pain management. Those people are telling that Ayurveda has not an instant results. So these techniques are very important techniques, and immediately you find the results. Like the Ramesh Rajguru already given you the parasurgical process, which is just these explaining surgical process. So you already find the results of that process. So Kurpar Marma clear. Now come to the next Marma point, Vijay ji. अभी छोड़ेंगे नहीं आपको. इधर आओ. कपड़ा नहीं उतारेंगे अब आपका. इधर आओ. Now come to the Indrabasti Marma. So we have to complete the upper extremity Marma points, and tomorrow I will explain the lower extremity Marma. Yeah.
When we are doing Marma, you have to
If
sit
you have
or
any
stand.
question, you can ask. Yeah.
You have to sit or stand.
Sit or?
Sit in sitting position. We have to do or standing position.
The doctor.
Yes, sir.
The doctor should be should be standing positions. He also should be in sitting position.
Somebody is seeing this and he asked the question.
No. Doctor also should be in sitting position. Here we are just doing a demonstration. That's why I am standing. It's not possible that you will stand on the OPD and do the Marma. But one thing I clarify you, these processes always, the protocol is that you have to just lying down the patient in the bed, table, and you have to do Marma. Like this is the right procedure. Come here. This is how you have to stimulate. The protocol is that you have to you have to say patient in lying down position. जब करना है, patient is there. Don't do comfortably. Just yes, and then you have to start from the Ansa Marma, then the Ani Marma, then the Kulpar Marma, then Indrabasti, Kshipra, and Talhandar Marma. So in this condition, the doctor will definitely be on standing position. If patient is lying down at the table, then you must have to be in standing position. But if the patient is coming on OPD and you are sitting on definitely on the chair, and the patient is also coming on chair, and you are just doing the like Kulpar Marma, like Indrabasti Marma, Urvi and Adi Marma, then you can do it on the sitting position. But patient should always be in sitting position or in the lying down position. He never be on the standing position. Okay? Clear? So now I am explaining the next point. This is the Indrabasti Marma. Just sit here. Yeah, now the Indrabasti Marma is just below the Kulpar Marma, 4 finger below the Kulpar Marma. 4 finger below the Kulpar Marma. Marker. We'll bring the marker. 4 finger below. Just locate this. This is the Indrabasti Marma. 4 finger below. Just here also. 4 finger below the Kulpar Marma. The Indrabasti Marma. Indravasti, as name itself indicates that this marma is directly related with the bladder. If you stand up and you just draw a virtual line between this marma, you find that the marma line passes through the urinary bladder, ureter, kidney, suprarenal gland. So this marma has a direct effect on kidney, suprarenal gland, adrenal gland, as well as the urinary bladder. Even in the cases of the female reproductive organs also, the line passes through the reproductive organs, so it has a direct effect on the bladder also. So in the female genital problems, reproductive problems also like PCOD, PCOS, this marma point is very, very effective. So this is Indravasti marma. Please sit. This is the Mans marma having Ardangula Pramana, Somya Agneya, Kalantar Pranhar marma. Somya Agneya, all the Somya Agneya marma are Kalantar Pranhar marma. Okay? So this marma is very effective. If somebody has constipation, somebody has urine retention, and you just stimulate this marma. Just simply stimulate this marma. And in the senior citizen cases where the urine is not to properly evacuated, you observe that the senior citizen will small stimulation, they just go for urination as the bowel urinary bladder is not completely clear. So in that condition, the Indravasti marma is very effective. Indravasti marma is also related with the blood formation, erythropoiesis. So it is very effective for those cases in which the blood anemia, hemoglobin level is come. The anemia cases also this is very effective. So directly, and you can see that ovarian cyst, in ovarian tumor, in the gynae problems also this marma is very effective. So this is the Indravasti marma. Clear? The location. So Indravasti marma you can stimulate along with the Kurpari diabetic cases. So those who are suffering from diabetes mellitus, you must have to stimulate Indravasti and Kurpar marma at similar time. So note down here. Indravasti and Kurpar, both the marma are very effective for diabetic mellitus. Now come to the next marma point. It is known as Manibandha marma. Manibandha. This is the wrist joint. And whole of the wrist joint is known as the Manibandha. You all know that we people always just tie a thread over here as a kalava in Hindu and Sanatani, as well as in our rituals, Raksha Bandhan and Guru Purnima also we tie kalava over here. So this is a Mani Bandha. Mani is a word which is used for the sensitive part, genital part, and Bandha is used for the tidy, means to control the genital area. So this marma point is directly related to the control, the sexual, the arrogant urges that is called, which is related with the sexual violence, or we can say that many other sexual crimes. So that's why you know that. That's why the criminals also with the locker, they just वो हथकड़ी इधर ही बांधते हैं, उधर ही वो पकड़ के ले जाते हैं रस्सा बांध के. देखा होगा आपने. This is the wrist joint. So wrist joint is known as Mani Bandha. Mani Bandha. And so you just look to the position of the Mani Bandha. Stand. Yes. Straight. Just draw a virtual line from the Mani Bandha to another Mani Bandha. You find that this line crosses through the genital region. So the genital area, it tights the genital area. So you can say that it reduces the reproductive area. So another question arises that is it good for the for treating the infertility? Maybe person will be sterile. You can say that, or libido will be controlled. No, it has no direct negative effect on the reproductive organs, but controlled brahmacharya. That is called the controlled reproductive activities. This will work. So Manibandha marma is also good for the Slesha cuff, so joint disorders. When we just do the movement of this point, as you know, the Sukshma Vyayama. So this is also for the rheumatoid arthritis cases or arthritis cases. Then how we can stimulate this marma? This marma is of 2 angula pramana. It is Sandhi marma and it is a Ruzakar marma. Ruzakar marma, Vayu and Agni Mahabhut Pradhan marma. So how you have to stimulate? You have to just make a hold, just tight your wrist joint like this. Then just put your thumb over the base of the thumb and put your middle finger and just attach with the thumb and just make a bow. Just firmly tie it and just move clockwise and anti-clockwise. Clockwise and anti-clockwise. You know that the clockwise and anti-clockwise movement definitely stimulates the Manibandha Marma. It has two aspects. One, it calm downs you. It calms down your virulent nature, anger, sexual behavior, and also it has a positive effect on the Slisak cuff. So that's why the joint movement is also proper. So sometimes if अगर आपकी किसी से लड़ाई हो जाए तो आप कुछ मत करो, लड़ो मत, don't argue with him or her. Just start stimulating your Manibandha Marma. Another person thinks that he is also now ready for fighting. Psychologically, he will also pull down himself. So double effect you observe, but this is actually the Manibandha Marma. So Manibandha, after the Manibandha Marma, the next point is very important. It is known as Kshipra. Kshipra. Kshipra means the instant acting Marma. Kshipra. Kshipra is at the junction of the index and the thumb. This is the point. This is the point, Dr. Rajguru. This is very important point for Vidya Karma and Agni Karma people. They all use the Kshipra Marma of the lower extremity. So Kshipra Marma, this is a Snayu Marma. This is a Snayu Marma. And this always keep this in your mind that Snayu Marma should be stimulated very carefully. And this is the point of the Kshipra Marma. How you have to stimulate this Marma? So I'm just showing you.
You have to just make your hand like this and just put your thumb in this web, and here your thumb comes. This is the point. This is Kshipra Marma. Do it. Stimulate it downward, up, down to 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 up, and again the same way. If you are doing for a patient, then you have to do like this. This is the Kshipra Marma. This is the Kshipra. This is the Kshipra. This is Snayu Marma, always remember. And this is definitely, this is a very good Marma for endocrine activities and also for the Avalamba Kapha, means lubrication of the heart and lungs is the key feature of this Marma. So this is the Kshipra. Kshipra is Snayu Marma, Ardhavula Pramana, and it is very effective for endocrine functions. So Snayu Marma, always carefully stimulate. And finally, the last Marma of upper extremity is Tala Hridaya Marma. So Tala Hridaya. So in the start of my lecture, I explained the name of the Tala Hridaya, and now concluding this session with the Tala Hridaya. So Tala Hridaya. Tala Hridaya. Tala means, do you know that the Hridaya is only one, but in Kashyap Samhita, 5 Hridaya is mentioned. 2 in the upper extremity, 2 in the lower extremity. Tala Hridaya. So how you can mark this Tala Hridaya? You have to just fold your middle finger and put this middle finger at the center, where the center it comes. Dr. Jadhav, this is very important Marma for you also. Kshipra and Tala Hridaya. I always request all the senior citizens, always stimulate this Marma. This Marma is directly affects just before stimulating this Marma, take the blood pressure, systolic and diastolic, and after stimulating this Marma, you just take the blood pressure. You find immediate change you find. So this is the center of the palm, and you can say that this is the Tala Hridaya Marma. Another way you can just find this. You just draw a straight line and just cut it from the middle. Just cut it from the middle, and at the center of the point, you will find same point where your middle finger comes. This point is known as the Tala Hridaya Marma. Tala Hridaya Marma is directly related with the heart. It improves the heart functions. It improves the heart rate. It improves the blood pressure, systolic as well as the diastolic. One thing arises in your mind: it increases the blood pressure or it decreases the blood pressure. So it maintains the blood pressure. It never decreases, neither increases. It maintains the blood pressure. If a person having normal blood pressure, it remains normal. If a person having low blood pressure, it increases. Yes, what is the question? Yeah, इधर हाथ दिखाओ. ये देखो, इधर focus कर दो. This is the Tala Hridaya Marma. Yeah. So always remember the extremities Marma. The female should first stimulate the left side, then right side. Keep this in your mind. The question arises why, and the male should stimulate first right side, then left side.
So this is a very common question which in your mind, why the female should first left and why the male should first right. The answer is that the female always, you remember that the Eda Nadi is predominant, that is Chandra Nadi, and you all know that in rituals also, in marriage also, we just keep female on the left side, Bhamangi. That's why always the female first you just stimulate the left side Mama in extremities, and in the male first you have to stimulate the right side Mama. So once first you left the in female you first stimulate the left, then right, and in male first right, then left. This is the common protocol, but in the condition of any problem like associated with any disease where you are feeling that the pain is more in the right side, in that condition, first either on the left or the right. But in the normal healthy person, you can Marma. So now finally the upper extremity Marma also completed. I hope that in this session, very brainstorming session, you got many information regarding the Marma, Agni Karma, and Vidya Karma and Rakta Moksha. Yes.
So if the nearby point swelling is there,
then yeah, very good question. She is asking that if there is an injury or there is swelling or any inflammation, can we do the Marma on that point? No, we don't stimulate. Whenever there is a Vedhan, Marma Vedhan, we don't stimulate that point in that area. You can do another nearby Marma points. Another question also arises that if the Marma point associated with some organ, like Indravasti Marma has direct effect on the urinary bladder, uterus. And if a female having a hysterectomy recently should avoid the stimulation of the Indravasti Marma. One of my students through online class, I just taught her about the Indravasti Marma and I just explained that it is very effective in the uterine area, ovarian area, and she thought in her mind that my uterus is just see. I think she just gone from the hysterectomy on 10 or 15 days, and she started doing the Indravasti Marma 2 to 3 times daily. In her mind, she thought that it will just heal just recover properly and see to any Marma if the associated organ having any surgery 6 months up to 6 months, because in the surgical process the Marma points related with the organ is already Marma Aghar, that area is already damaged, so it has to be first regenerate, then you have to use the corresponding stimulate the corresponding Marma. So I think that any question? Yeah, for kidneys only. This is Indravasti Marma and Kulpar Marma. Kulpar Indravasti Marma is effective in diabetes, in dialysis cases, and the cases where the gynecological problems, fibroid. So many patients, so many doctors join my Marma sessions as they told me that my fibroid just dissolved by this stimulation of Indravasti Marma. And I already explained that it has a direct effect on the Apan Vayu as well as the intestinal movement. So if a patient having constipation, either retention in urine, and either any obstruction, like in the prostatomegaly cases, the urine is not completely cleared, evacuated in senior citizen cases, in that condition you stimulate the Indravasti Marma, it is very effective. So I think that any question from your side? So I think that how much time? Cerebral palsy. Yes, cerebral palsy, always remember, cerebral palsy we have to first do the lower extremity Marma, which I will explain in tomorrow's session. Then we have to stimulate the back Marma. Then we have to stimulate the upper extremity Marma. And at the last we have to stimulate the Marma of the head region. And I assure you, if you start this stimulation on a child who is suffering from cerebral palsy, yeah,
that is 2 years and 6 months.
Yeah, you start. Ultimate results you find. And yeah. But how? You are here, and child is in your village. How much distance? How much distance from here? You bring now. No problem. You just bring that patient. Tomorrow you bring. Yeah, call the parents of that Fine.
possible, I will.
Yeah, you just just to tell the is she a child, female or male?
Male.
Male. Parents just communicate, and if they allow, they bring them there.
The main problem is now he is not able to pick the right.
Yeah, you just got immediate results. Just bring them. Yeah, immediate. Just bring them. Just tell them, doctor is coming, Marma doctor is coming, and just call them to come here. So thank you to all of you. I hope that you enjoyed this session very well, and all the people who are joining from Zoom also, and 43 people are joining from the Zoom, and as well as many people who just watched this session in Facebook. I request all of you to just enjoy the second day also. In morning time, we will meet at 6 a.m. in tea stomach. And I think that there is a tea. Doctor, tea is ready. So just enjoy your tea. And second day is also very important. So don't forget to miss the second day session. And finally, your certificate is only given on the second day. So today it's enough, I think. Okay, thank you. Take care. Bye bye. Namaste.